All right, listen up. Your practical is tomorrow. This is it, your final rapid-fire review for fungal infections. We're going to cut through all the textbook fluff and give you exactly what you need to know to walk in there with confidence and absolutely nail it. So, picture this. You're on the floor, the clock's ticking, you've got a patient with symptoms that are screaming fungal infection. What's the very first thought in your head? Your first move, always, is to know your enemy. Before you do anything else, you have to understand what you're dealing with, because the difference between a fungus and a bacterium, that difference can literally be life or death.
Okay, section 1. We are not doing a full mycology course here. This is the clinical need to know. What makes a fungus, and more importantly, why the heck does that matter when you're treating your patient? Let's dive in.
So, have you ever wondered why you can't just throw antibiotics at a fungal infection? This is why. Bacteria are simple. Fungi are complex, eukaryotic cells, a lot like our own, actually. But here's the secret, the absolute Achilles heel of the fungus. Its cell membrane has something called ergosterol. Our cells have cholesterol, they have ergosterol. That one little difference, that's the golden target for our best antifungal drugs.
It's also super important to remember that not all fungi are out to get us. You've got your friendly neighborhood baker's yeast, Saccharomyces cerevisiae, totally harmless. But then you've got guys like Cryptococcus neoformans, and when you hear that name, your brain needs to light up with warning signs. We're talking serious, deadly infections, especially meningitis. Knowing who's a friend and who's a foe is your first step in risk assessment.
Let's move on to identification. You're going to see lab reports, and you need to know what they mean. Is it a yeast? Is it a mold? Because believe me, the shape of the fungus tells you a lot about how it's going to cause disease.
In the fungal kingdom, you're basically going to run into 3 main forms you have to recognize. You've got yeast, you've got mold, and then you've got this tricky one in the middle called pseudohyphae. Let's break them down. And this shows the 2 main players perfectly. Over on the left, that's yeast. Think of them like tiny individual round cells that just butt off each other. Because they're so small and free-floating, they can get into the bloodstream and cause absolute chaos systemically. Now look to the right. That's mold. Totally different. It's made of these long, branching threads called hyphae that weave together into a web, perfect for digging deep and invading tissues. And now for the great pretender, pseudohyphae. At a quick glance, you might think it's mold, but it's not. It's actually just a chain of yeast cells that forgot to separate after budding. So how do you spot the fake? Look for the pinch. You see those little constrictions between the cells? That is your dead giveaway. And when you see pseudohyphae on a lab report, the #1 name that should pop into your head is Candida.
Okay, so you know what it looks like. Now where is it attacking? The location of a fungal infection is everything. It tells you the threat level, the urgency, and how you're going to build your care plan. We can pretty much break all fungal infections, or mycoses, into 4 levels of severity. Think of it like a ladder of danger. We start at the bottom with superficial, just on the outer skin. We climb up to cutaneous, hitting the epidermis, hair, and nails. Then we go deeper with subcutaneous, down into the underlying tissue. And at the very top, the most dangerous of all is systemic. The fungus is now inside the body's organs. So let's map this out real quick. Superficial and cutaneous, that's the stuff you'll see all the time. Think ringworm or athlete's foot, skin, hair, nails. Subcutaneous gets a little more serious, usually starts from a cut or a wound, but systemic, that's the red alert zone. The fungus is inside and it's gunning for major organs like the lungs, the liver, and the spleen. When it comes to those cutaneous infections, your eyes are your best diagnostic tool, so check these 2 out. On the one hand, you have tinea versicolor. See how it causes those light or sometimes dark, splotchy patches on the skin? Now compare that to tinea nigra. Whoa, that's way darker. You're looking for distinct black or brown patches. Being able to spot that difference immediately puts you ahead of the game. All right, we're picking up the pace now because the second you hear the words systemic mycosis, your brain has to shift into overdrive. This is not a rash. This is a full-blown medical emergency. The enemy is no longer at the gates, it's inside the castle, and it's threatening everything. So what does it look like when the body is fighting a war against an internal invader like histoplasma? It looks like this, a granuloma. This isn't just a little inflammation. This is an all-out battle where your immune cells are literally building a wall to try and contain the fungus. When you see this, you know the body is fighting a deep, serious invasion. So for systemic infections, you have to know which organs are in the crosshairs. For coccidioides, which you might know as valley fever, you're worrying about the lungs and the liver. For histoplasma, it has a thing for the liver and the spleen. Knowing their favorite targets tells you exactly which labs you need to be watching like a hawk.
Look, if you boil it all down, this is what you get. Superficial infection, it's a nuisance. You might use a topical cream. Systemic infection, it's an absolute crisis. Your response has to match that threat with immediate, aggressive intervention.
Okay, you've identified the fungus, you've assessed the threat. Now what do you actually do? This is your action plan, from getting the diagnosis to administering treatment and keeping your patient safe. So the lab gets a sample. They're probably going to plate it on something called Sabouraud's agar. And here's why that's so brilliant. Fungi grow incredibly slowly. Bacteria grow super fast. Well, this agar is acidic, and bacteria hate acid. So it basically wipes out all the fast-growing bacteria, clearing the stage for the slow-growing fungus to finally appear. It's a really smart trick. Now, let's talk about safety, your safety. If you have any reason to suspect an airborne systemic mycosis, you gear up, no hesitation. This is the non-negotiable checklist: an N95 respirator, gloves, a gown, and eye protection. You do not take chances. You protect yourself, and you protect everyone around you. All right, let's talk meds. These drugs are lifesavers, but they're powerful, so you have to monitor for side effects. For one of the most common classes, the azoles, I want you to burn this into your memory. The azoles are tough on the liver, so zone in on LFTs. Got it? Azoles means you are watching those liver function tests, period. Think of this as your critical safety checklist for antifungals. If you're giving Amphotericin B, they call it amphoterrible for a reason, your #1 priority is monitoring renal function. For the azoles, like we just said, it's all about the liver. And for the echinocandins, you are glued to that patient, watching for any sign of an infusion reaction. This is your job. This is patient safety. Okay, deep breath. This is it, the finish line. Final exam, rapid recall. I'm gonna fire off a question and I want you to lock in that answer in your mind before I give it to you. Let's do this. First question. What is that one special component in the fungal cell membrane that our biggest antifungal drugs go after? The thing that they have, but we don't. You got it? The answer is ergosterol. Amphotericin B binds to it, wrecking the membrane, while the azoles stop the fungus from even making it. It's the perfect target. And let's leave you with this final, crucial concept. Morphology dictates invasion. The shape of the fungus tells you how it attacks. Those small, round yeast cells can travel the bloodstream and go everywhere. But the long, filamentous molds, they dig in deep and destroy tissue. Understand the shape, and you will always understand the threat. You are ready for this. Now go ace that exam.